we know that the metaverse is also a lot about blockchain and crypto. So let me start by perhaps introducing Mr. Hoang Nhu, who has multiple patents and who has been an innovator for many, many years. And he is the CEO and founder of Nouslogic. Would you take a moment to introduce yourself?
Thanks, Helen, for the kind words. Yes, I'm Hoang Nhu, founder and CEO of Nouslogic Telehealth company based in Irvine. I have over 30 years of experience in various technologies, starting with HP at their R&D labs, working on the signal processing algorithm and A to the analog to digital chip design. And that is a precursor for today's very high technology trend, which is digital transformation. You heard of digital transformation, which is basically you convert analog physical world into digital so that you can move it through the metaverse, for example. And then after HP, I spent my time at Broadcom, also at Irvine campus, which is a wireless IoT company. IoT stands for Internet of Things. And there I learned how to process signals and then stream them over the internet to connect. Their motto is connect everything. Again, that is a precursor for today's together with digital health data. Okay, all those experiences prepare me well for the metaverse and transmitting health data together with audio and video. And that is, in a nutshell, is the telehealth and RPM, remote patient monitoring features that we support in our smart platform. RPM is a program that is reimbursable by Medicare starting in 2019. And that is very timely because in 2020, when COVID started, lots of services are from remote. For example, you can have WFH, work from home, or online classes. And in our case, we use the acronym WFH for wellness from home. So we monitor patients' health status and wellness via the internet. Yes.
So if I understand well, we have technology that we can actually stick to our body, or, right? Just like the one. So you're wearing one right now, and this is monitoring what?
ECG, body temperature, heart rate, breathing rate, and daily activities via 9-axis accelerometers. For example, if you sleep too much or if you fall, it can detect all those events and notify in real time your family members or even 911. Yes. And we have the uniqueness of our platform is that not only we monitor the physiological health output signals, but also medication intake or whether you exercise enough affects a lot to the physiological output as well. So, for example, I have here our, we are about to launch okay, in exchange for $1 billion token, MDDAO. Okay. It monitors all your medication intake, and what is unique about it, it can count. Basically, it's a weight scale. Okay, it can count how many pills you have taken, and whether it's at the right time or not. If you forget that, it can remind you. Okay, that way, if you overdose or underdose, you just put your pill bottle over there, and it will just work. And the neat thing is that, like I said earlier, I work on with Broadcom, the wireless company. Unlike other health devices, you use Bluetooth or Wi-Fi, which is hard to set up because you have to pair it or enter the Wi-Fi password of your home. This is via a new wireless standard called LoRa, long range. And it's also just like MDDAO, it's decentralized healthcare. Here it's decentralized, they call it decentralized people's network. Because unlike Verizon and AT&T, which requires cell towers, this, in everybody's home, you can set this up yourself. So it's called the decentralized people's network. Very simple it's really a plug and play device. You just put there, actually from the doctor's prescription at the pharmacy, that's what I meant earlier by digital transformation. From the data, the prescription, it will automatically go through the internet and program this device at the patient's home, such that when the patient take the pill bottle to the home, and this device knows when and how much, what's the dosage the patient is supposed to take, and at what time.